Good morning and welcome back. We have Dr. Shushmita Nair from Atrium Health Navicent joining us. Thank you for being here today.
Thank you for having me.
I'm excited to have you here because September is a really big month. September is Pediatric Cancer Awareness Month, and so I want to talk about it. There's a lot of resources at Atrium Health Navicent. What resources do you guys have available?
Oh, of course. So we at Atrium Health Navicent have a full-fledged pediatric hematology oncology clinic, which has right now 3 board certified pediatric hematology oncology physicians. We have 4 AFON, which is the Society of Pediatric Hematology Oncology Nursing. So 4 AFON certified nurses. We have a child life specialist. We have our own social worker. So we have this clinic right here in Macon, providing care in pediatric hematology oncology for our patients locally rather than them going all the way to Atlanta. We provide chemotherapy infusions, the short ones in the clinic, and see the patients there. We have a lab on site where we can quickly do some numbers, blood counts, and the other longer chemotherapy infusions are available at the Children's Hospital. We have an outpatient infusion center as well as the inpatient where patients can be admitted and treated.
I think the important thing is this is right in our backyard. This is here in Macon, so you don't have to travel and go all the way to Atlanta. You can get help quite literally in your backyard. And so with September, trying to raise awareness about this, what are signs that we should be looking for with our kiddos? What is something maybe we need to be aware of?
Yeah. So the first thing I want to say is pediatric cancer is real, because people think how can cancer happen in children? So it happens. There are about 15,000 cases of cancer in children being diagnosed every year in United States. If you talk about the world, it's more than 400,000 plus. So it's real. Be aware that it does happen in children. So what are the signs and symptoms? Nobody, when a child presents with any sign or symptom, cancer is not the first thing on your mind. So it's not common, but it does exist. So the most common cancer in children is blood cancer. So some of the symptoms which can happen with blood cancer, which can be a red flag, is if your child, normally children are running around, active, playful. If there's change in activity, you see child is getting tired easily, so that's a concern. If the child is bruising or bleeding, or if the child is not doing what they are supposed to do, like run around and play, so just get the child checked out with the pediatrician. Or if they're having fevers which are not going away, just get blood counts checked. Sometimes these can be vague presentations, just like fever. You get treated for a bacterial infection or just wait it out thinking it's a viral, but sometimes it can be the first presenting symptom of blood cancer. Wow. The other most common type of cancer in children is brain tumors. So again, the big thing in children is they should develop normally. They should gain their milestones on time. But if you see your child is for some reason losing the milestones which they've developed, like stopped walking or refuses to even sit up, then that's a concern. So
and go see your doctor immediately.
Yes.
I think that's important. Understand that 15,000 kiddos in America each year are having pediatric cancer. So in honor of September being Pediatric Cancer Awareness Month, make sure you're watching out for your kiddos. If you notice anything's a little abnormal, get them checked out, and definitely we'll have all this information on our website, 41nbc.com. Thank you so much for being here today.
Thank you.